Good morning, everybody. So this is a brief synopsis about the communication station. Sounds pretty benign, but actually it probably is not, because a lot of candidates, the Caucasian candidates are non-white candidates, a lot of candidates fail in this station, and it's very, very important that you get good score in this station. So communication is the cornerstone of any doctor's consultation. More or less, we as doctors, we do know how to examine a patient and how to come to at least a provisional diagnosis. But communicating the same is very, 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 very important. And it's a problem with us in India, because we were all taught to know the causes of a condition. So we know 20 causes by heart. We are encouraged to be good doctors. We are encouraged to be thorough doctors. We are encouraged to get good marks in exams. We are never taught how to communicate with the patient and the patient's relatives. So there's a perception problem here. So when we talk to patient and patient families, we think that they are all familiar with medical terms. That is not the case. And the culture here is in our society is that the doctor is somewhere here and the patient and patient relatives are somewhere there. So there's a lot of communication gap. And I've heard many times a lot of jargon being used. I've heard people say, oh, you know, your dad is not well because his MAP is very low. Well, what the hell is MAP? They wouldn't know. So you have to tell them that your dad is not well, he's not maintaining his blood pressure keeps on falling, and that is not good for your dad. But we don't say that. We say his MAP is not good, your dad is not good. So who the hell knows what the MAP is? So please don't use, and medical jargon, I've seen it. I saw it yesterday, I saw it day before. It keeps on happening again and again. So doctor-patient relationship is very important. And for us, English is not the first language, so it often becomes very difficult to say the terms in English or translate the terms in Bengali or Hindi. So, but with practice, with empathy, keeping in mind that you need to clearly communicate in simple terms with the patient, you can actually ingrain it into your routine practice. And you have to remember, when MRCP basis is over, you have all got your MRCP under your belt, then you start practicing as consultant, physicians, surgeons, or whatever it is. What makes or breaks your case is communication. Complaints arise because of communications. Complaints can be averted because of communications. I hope my senior colleagues agree with me. So this is what? So these are the points. And if we divide it, we can divide it into a few broad categories. So one is you explain it. Somebody's got a new diagnosis, whatever the diagnosis. You need to explain in clear terms to the patient and the patient's family what the diagnosis is, what it means for the patient's life, the rest of the life, what the treatment will be, whether the treatment will be long-term or short-term, what the implications will be. So that is number one. So explaining or giving news about a new diagnosis. The other very important thing is breaking bad news. Somebody's got a life-threatening illness, some patient is very, very poorly. You need to tell the family and the patient that your parent or your next of kin is not going to get better, and you need to tell the patient that we don't have much treatment to offer, but this is what we can do. That is very important. Consent. You want to do any procedure, you have to do the procedure. It's important the patient has gets the procedure done, but you have to explain in clear terms what the procedure is, why the patient needs it, what the procedure entails, how we are going to do it, what are the medications or drugs that the patient is going to get during the procedure, what the side effects of the procedure are, and what are the chances of dying or adverse effects out of the procedure. So each of these has to be all the points have to be done. So for example, when I do a bronchoscopy, I tell them why they need the bronchoscopy, what does bronchoscopy mean, what discomfort the patient will feel, what medications will give them, are they going to get unconscious or they are just going to sleep, what medications they need, what the side effects might be, what are the chances of dying out of bronchoscopy, and what are the discomforts they might feel after the procedure, and what are the advantages of having it. So you have to break everything down. It's very, very important, because otherwise, it sets a bad precedent. You're going to fail the MRCP, and otherwise someday one might turn around and say, Amari problem to hoye, I've had this problem, you never mentioned that I could have had this problem. So very, very important. Critical incident, wrong dose of insulin, overdose of insulin, the sugar goes down very low, the patient goes hypoglycemic and goes unconscious. Very serious incident. Wrong dose of medication, wrong route of medication. So then you need to inform, I'm sorry, this has happened, I'll ensure this will never happen again. So these are the things. Ethics, you need to discuss some certain tests that the patient needs doing, the patient doesn't want to have done. They need to explain gently why the tests are important. And then handover between your colleagues. A seamless medical care needs a proper handover. Very, very important. Important points need to be highlighted, the unimportant points need not. But that is also very important. So communication to patients, to family and to your colleagues. This is very, very important. So what is the purpose? Complicated medical information in simple terms, in a simple manner. Connect with the patient. You need to have some sort of connection. You know, if they think that the doctor is difficult, the doctor doesn't care, the doctor appears angry, the doctor doesn't appear concerned about my father's or mother's condition or whatever it is, there's complete disruption in any trust that is supposed to build up. Breaking bad news, very, very important. You just can't walk into the room, sit and say, actually, your dad has got cancer. No, that doesn't work out that way. Explore issues. What are their concerns, their hidden concerns? If there's any conflict, angry relatives, angry patient, what is the reason for the anger? Why did they come? How did they get to this stage? Very important. Today's day and age, resolving conflict and breaking bad news are two very important skills that you need to master. Ability to teach, discuss, explain topics that we can come later on, and compare. Conveying all the information is a nutshell, in a proper form, in a language that is lucid, in a language, in a manner that everybody can understand. So you have to decide what your job is, how we are going to do it. You might need to change depending on the other person's reaction. Non-verbal cues, your eyes, your body language, the way you dress, the way you sit, the way you look at them, that is very important. And when all is done and dusted, you need to tell them, so this is what it is, this is what we have, your parent has got, this is what we need to do. If you have any questions, please let me know. I'm available on such and such times, or contact my registrar. He or she will be able to help you, otherwise I'm always there. So this is very, very important. Some sort of reassurance. Yes, you've got some unpleasant news, but at the background, I'm always there. So make notes if possible. So if you think it's a difficult thing, please make notes, just a rough note. Plan how to break the bad news if the news is bad. Have a seat or whatever, we've had some tests done, we've got the reports back, and afraid the news is not that good, there's some unpleasant findings in the report. So introduce yourself, obviously, I'm so and so. Ask who that person is, whether there's patient's son or daughter-in-law, whoever it is. Eye contact is very, very important. Look straight into their eyes, not in an arrogant fashion, but in a way that shares your concern. Try and know what their perception is before the next of kin came to hospital. What were they expecting? What were they worried about? And then you can build up from there. Wait, don't rush. You can't time yourself for communication or breaking bad news. Wait for them to respond, and then you can carry forward your communication. Go with the patient's relative space, summarize and check how much they have understood. Very important. Sometimes you tell them very nicely in their mother tongue, but then again all is blank for them because it's sometimes too much to take in. So most of your communication is non-verbal, very important. So how you sit, you can't sit like this, you can't tap your pen like this. I've seen people do it. Your clothing is very important, your eye contact is important, no arrogance on your face, gestures is very important, no unnecessary touching the patient, no saying, I'm so sorry. No, you have to gauge whether they want that done or not, and give everybody a personal space also. So you need to be close to them, but not invade their personal space. So go through it very carefully, and your purpose of the communication, giving the diagnosis, breaking bad news, explaining them about the procedure, or discussing the critical incident, that is the purpose. So the principal purpose has to be communicated. If you don't, then you're going to fail basically. Very important, get the patient's name right, the gender right, okay, and get the patient's, I have made mistakes, I've said, are you the patient's dad? No, I'm patient's husband. So a few times we have made the mistake as well, but that's a different. So get the information right, who is the person you're talking to, the patient's name, patient's gender, very, very, very important. The important information you need to give, and what they expect out of you, what they expect out of the hospital. So saying sorry is not in our culture. We think we are doctors, we are superior beings, we are highly qualified. Yes, we are highly qualified, no doubt about that. We are cleverer than the rest of the society, no doubt about that. But we cannot show it that way, because we are in the domain of public service, social service. So saying sorry doesn't hurt. Sorry I couldn't talk to you yesterday, I was really tied up in something. Is please sit down, have a seat, how can I help you? Words diffuses the whole situation completely. Or empathy, I'm so sorry you have to run back and forth through the hospital. I know you're going through hell, it's a very difficult time. Say that. Half the conflict, half the anger goes away. Body language again is very important. Don't let your phone do cring, cring, cring all the time. And even if the phone calls, you have to make sure that you don't speak while you're giving a serious news or bad news. If you think that communication might be difficult, or the relatives might be a bit angry, a bit agitated, ask for a colleague, ask for a nurse. I often do that. And take somebody, and no table in between. So you can't be sitting here, they can't be sitting there, and there's already an invisible divide. Information gathering. So this is not history taking. History taking, we ask probing questions. Did your dad smoke? What work did your dad do? Did your dad used to take alcohol, etc., etc. These are history taking questions to arrive at a proper diagnosis. That is different. This is communication. The person has a problem, you have detected the problem, you need to communicate the problem, not ask further questions. So don't elicit further history, but if the role player offers more history background, then please listen. Okay, but however, at the same time, every step, you need to understand what the other person knows about the case already, because people can be very clever. They might already know a lot. They might have Googled the case. They might have used the AI before they come and talk to you, particularly in today's day and age. So it's very important, don't try and fool them, and be honest about it. And if there's certain things that you don't know, then tell them, I'm not sure about the entire thing, I'll check with my colleagues and then I'll get back to you. No harm in doing that. I often during my consultation, I often say, okay, hang on, I don't know the dose of the drug, let me check and then I'll write it for you. So body language, warning shot, breaking it down, and don't take hope away completely, yes, your dad has got incurable cancer, there's nothing we can do, but no, you can't say that. Some hope has to be there. Well, we can't give definitive treatment, but we'll do all we can to make his life comfortable so that he has a reasonable quality of life and can manage himself or herself at home. So some sort of hope should be given. You can't take everything away from them with one go. So spikes is the short form of what we have discussed. So the structure, the perception, the invitation to talk, the knowledge, the empathy, and summarizing the whole thing. Breaking bad news, as I said before, I've gone all of this, so have a seat, I'm afraid the news is not good, blah, blah, blah. So what do you know already? What were you worried about? What do you think what your dad had before you brought him to hospital? So start at some level so they are prepared. And then you will be surprised how much they already have guessed. So sometimes you don't have to give the bad news entirely. They will often volunteer as So yeah, actually I was very worried. He hasn't been eating for the last 3 months. He has been losing weight for last 6 months. He hasn't been himself. So even your job is half done. So they have already been suspecting that the next of kin has got some life-threatening illness. So always ask or try and gauge how much they know or how much fear about the condition they have had in their minds. Use non-technical words, as I said, no medical jargon, and avoid excessive bluntness. Have a seat, your dad's got cancer. No. Have a seat, I'm afraid, are you his daughter or son? I'm afraid the news is not good. That's how you start. Give information in small chunks, as we all discussed. Prognosis is poor. Avoid phrases as nothing more we can do for you. That is not the way you do it. You have to say there's no curable treatment or there's no definitive treatment, but there's a lot of medications that we can give to make their lives comfortable. Good pain control and symptom relief, very important. And then, certain clear fail points. You can't blame and accuse. You can't say, oh, you have smoked, that's why you've got this. You have led an erratic lifestyle, your sugar was not controlled, you never listened, and that's why you've got heart attack. You cannot say these things. You're never going to pass. Don't lose patience, don't be rude. These are simple things. Don't be dismissive. Oh no, I don't agree with it. You can't say ye ho hi nahi sakta, eta hote hi pada na, this is not possible, what you think is completely wrong. You cannot say that. You can say no, I don't think that is the case, but I'm afraid you're right. I know where you're coming from, because these symptoms can be seen in other conditions as well, but I'm afraid this is the condition, this is the problem your parent has got. But don't say no, you're wrong. To try and convince them that you're here for them, because that is what we are, isn't it? We get paid because we look after patients, we make a diagnosis and we treat them and help them. Must not lie. If you don't know something, or tell them that you'll find out and check. All information might be correct. We are not Encyclopedia Britannicas, we don't know everything, we need to go and check at times. Be absolutely sure before you say anything, because you might say something and move on to the next patient, but what you say stays with the family and the patient for the rest of their lives, and this is going by my personal experience. So reassure, but don't excessively reassure. Don't say don't worry when there's a lot of problem actually happening. Think about how you're going to disclose information when a patient is dying and the person asks, is he or she going to be okay? No, the person won't be okay. But you have to say, you have to make your way out, and that depends on the person in front of you. You have to say, he may not be, what shall I say, things don't look great for him, but we'll try and see if he can eat. So that depends on the situation you're in. Offer support and appropriate volunteer if they want home care, if they want nursing care, physiotherapy, nutrition help, please offer that. Untoward incident, very important. Wrong dose of drug, side effects, wrong medication, wrong route. So this is very important scenario. Explain, first say sorry that this has happened, should not have happened, and say that it's in their duty, it's their right to complain, and if they want to complain, a written formal complaint, please help them with that. Say that you will escalate the situation to the medical director, the nursing superintendent, whoever it is, but say that you will do all you can to make sure that this never ever happens again. Don't bring certain person into the scenario and make them a scapegoat. We should be like airlines industry. We are not here to name and shame. We are here to make the system foolproof, so that this untoward or critical incident never ever happens again. Okay, so very, very important. Say you're sorry that it will never happen. We will treat all you can to avert the situation. Make sure that the patient comes to no harm, that you will escalate the problem to the higher authorities, and that you'll do your best to make sure this never happens again. Okay, very important. These are very common these days. Conflict resolution. Why the patient is agitated, why the family is angry, why the family is shouting, a very common scenario these days. Listen first. They might shout at you, they might scream at you, but sit quietly, patiently, and listen first. Believe me, for 3 or 4 minutes, when you have sat quietly and you have listened, and they have they have vented out their frustration, you will see most of the times how easily the whole situation gets dissipated. Then try and find out what happened really. It's not probably you, but somebody else misbehaved, somebody else said something they did not like, and it's fallen onto you to avert the situation. So information giving, again, as I said, you may not know the whole thing, maybe a new genetic diagnosis, maybe something entirely new, but please make sure that you say as much as you know and volunteer the rest of the information once you've gathered all the information. If it's a familial condition, ask about family history. The relatives might already know somebody in the family and may know about the condition. If you're not sure, please find out and say that you'll find out and come back to them. Okay?